How important do you think are the recently reported findings of the ELECTRON trial for treatment of patients infected with hepatitis genotype 1?
So the ELECTRON trial has been a many-stage trial looking at multiple genotypes of hepatitis C over a several-year period. Clearly, one of the major genotypes being studied in ELECTRON was genotype 1, and it sought to examine two groups of patients. Treatment-naive patients who had never been treated with any antiviral therapy, and patients who had received a prior course of PEG interferon ribavirin and having failed such a regimen as a so-called null responder. That is to say, those patients failed to experience a 2-log decline in their HCV viral loads during the first 12 weeks of treatment with PEG interferon ribavirin. These two groups were studied earlier in a version of the ELECTRON trial with a regimen of sofosbuvir and ribavirin given for 12 weeks. So sofosbuvir and ribavirin produced very encouraging results in genotype 2 and 3 naive patients with, in one particular well-publicized study, achievement of 100% sustained response rates. But those rates were not nearly as sanguine in genotype 1 infection for the same regimen of 12 weeks of sofosbuvir, a nucleotide polymerase inhibitor, and ribavirin. Those rates were diminished particularly in those patients who were prior null responders, with rates of sustained response only at 10% in that group of patients. So realizing that there was a problem with either duration or the regimen itself, the ELECTRON trial was subsequently amended to add in a second class of therapy to those genotype 1 patients, both treatment naive and null responder patients. That regimen added, or that class of medicine added, was ledipasvir, an NS5A inhibitor, also potent activity against hepatitis C in vitro. Ledipasvir was added to sofosbuvir and was also given with ribavirin. So you had a 3-drug regimen consisting of 2 direct-acting antivirals and ribavirin. The response rates seen in patients who were either treatment naive, 25 such patients with genotype 1, or treatment null responders, 9 such patients, were nothing short of spectacular. Each of those patients not only experienced an on-treatment response with clearance of virus during the regimen, but more importantly, achieved 100% rates of sustained virologic response 12 weeks after completion of therapy, the sine qua non that we view as being curative. So these data clearly open a new vista for all of us in thinking about our ability to succeed with a short course of a, in this case, 2 direct-acting antiviral plus ribavirin-based regimen in achieving not just high rates or prohibitively high rates of response in our treatment-naive patients, but even more importantly, those patients who have been recalcitrant and non-responsive to prior regimens of PEG interferon and ribavirin. So clearly the addition of 2 potent classes of direct-acting antivirals, in this case with ribavirin, but in other cases, in other studies, even without ribavirin, have begun to produce the kinds of responses that we view as being extraordinarily attractive when we think about a potential one-size-fits-all approach to our future patients.